Well, once again, good morning to all of you, and on behalf of the Engelberg Center for Healthcare Reform at the Brookings Institution, also on behalf of the New School and the Center for Health Transformation, I want to welcome all of you to this morning's event. We're delighted to have you here to discuss some very important topics related to long-term care and healthcare reform. Many people here are experts in these areas. Many people are passionate in these areas, are making changes. And the fact that we have such a large and diverse group in the audience today, including former leaders and current leaders at CMS and the Administration on Aging, and members of Congress and Hill staff, academic experts, consumer and patient advocates, industry leaders, healthcare foundations, representatives from health plans, providers, other groups. This is a very promising sign of the level of interest and the breadth of support for addressing the important challenges before us in the areas of long-term care quality and financing. Our forum today emphasizes that these reforms go together. Getting better quality, getting care that's better suited to the needs of our diverse population, and taking steps to address the financial sustainability of our long-term care services go together. By linking steps to improve quality and efficiency of long-term care to steps to improve financing, more can get done than if we simply approach the problems of quality gaps and financing gaps separately. At Brookings and at the other organizations collaborating in this event, there's a lot of work going on with respect to other aspects of health care reform. After all, this is a major domestic issue for the presidential campaign, and it should be. But perhaps there's been a bit less recognition of the fact that there is actually a high-level, broad-based, and bipartisan foundation for action on long-term care reform. You're going to hear more about that in a minute from our next speakers. This is the result of recent national efforts to identify and raise awareness for solutions like the work of the National Commission for Quality Long-Term Care. It's also the result of activities to promote real reforms in the actual delivery of long-term care services, like the Advancing Excellence campaign. But most importantly, it's the result of activities taking place all around the country that are showing the way to do it better. Working in Washington, including at CMS, I had the opportunity to see and hear about a lot of these activities, from new approaches that are redefining what institutional care means, to new kinds of living arrangements with supportive care, to new approaches to home care and augmenting unpaid caregivers, to protests from groups like ADAPT to make it all happen faster. There is a tremendous amount of activity and energy around the country. But as I think you'll hear today, it's not just activity, but what seems to be emerging. There is an evidence-based consensus, not only that we need reform, but how we can do it. The need to think broadly about not only nursing home care, but about the other settings of long-term and supportive care, home and community-based care, other types of support services are becoming increasingly mainstream and prominent in the delivery of these services and supports. The need for better measures of quality and efficiency and support tied to all of these measures of quality rather than just paying money the same old way. The need for additional efforts to give individuals and families more personal control of their care and care settings based on their functional needs and preferences, not based on the way that we've paid and regulated in the past. The need for new and better information on quality and choice for individuals and families, like CMS's Nursing Home Compare and its recently announced 5-star nursing home quality rating system. The need for concrete steps to address long-term financial sustainability. The need to reduce the financing shortfalls that exist, or at a minimum, identify new funding sources for improvements in quality and better care without worsening our fiscal outlook. And to make it all happen, the need for a broad range of stakeholders and groups that have not always worked well or closely together, that have not always trusted each other to find new ways forward, new common ground to make these changes happen. This morning, we're going to be taking stock of where we are on long-term care reform issues, and most importantly, how we can move forward together. We're going to hear remarks from a number of speakers and people who are experts in the fields of long-term care and healthcare finance, quality improvement, public policy, and personal and family support, as well as policy leaders who have spent a tremendous amount of their own time on long-term care issues and healthcare reform more generally. And while this is a large group here assembled today, we do want to encourage open discussion and interaction with all of you. There will be microphones roaming around in the audience after each of the panel's opening discussions. At that point, you can just raise your hand if you have a comment or question, and we will try to get to you. We're also viewing today's meeting as a basis for a continuing and more comprehensive effort to make progress on long-term care quality and financing that builds on the great work done by many of the people here today. So we hope that today's discussion is going to particularly highlight next steps that we can start undertaking right away with your help. This meeting is not simply an opportunity to talk about where we might go with a broad range of people and perspectives who can really make a difference. It's about taking steps forward together to actually get there. Now, I'd like to recognize the co-sponsors of today's event, who are also some very important leaders and I know are well known to all of you. Senator Kerrey, who's with me on the panel today, and Speaker Gingrich have worked hard to make today's event possible. Before that, I just want to make a few housekeeping points to help us get started. This event is being webcast. It will be available soon on the Brookings website. We're also working with the Kaiser Network to make this available widely. There will be press in attendance today, and I expect all of the comments here are going to be on the record, as it were. And I'd like to remind the presenters and the people in the audience that we have a lot of ground to cover, a lot of perspective, so we're looking for people to keep their remarks and questions brief in order to allow some time for discussion. I'd like to start now by recognizing a couple of friends and colleagues who have been true leaders on long-term care and health care reform issues, who have given their time and efforts and ideas because they view long-term care reform as one of the nation's most pressing challenges and opportunities. And I'll start with Senator Bob Kerrey on my left, a former governor and two-term U.S. Senator from Nebraska who's currently president of the New School in New York City, where he is leading a period of unprecedented growth within the university. He's a champion of education and its ability to encourage change within the democratic process. Senator Kerrey, as many of you know, served alongside Speaker Gingrich as co-commissioner of the National Commission for Quality Long-Term Care, which worked to lay out real solutions to the pressing questions that we're discussing today, the pressing questions shaping how an aging generation will live. I'd also like to introduce Speaker Newt Gingrich, former Speaker of the House of Representatives who served in Congress for 20 years. Since retiring from Congress, the Speaker has worked extensively on issues related to health and health care, as well as a range of other key domestic and international priorities. And this has included leadership around the need to accelerate the development and use of health information technology to transform health care. But it also has included a big emphasis on long-term care and many other issues. Speaker Gingrich, as I mentioned, served as a co-commissioner on the National Commission for Quality Long-Term Care, and he is now the founder for the Center for Health Transformation and the Gingrich Group. They worked together on the National Commission. As the Commission stated in its final report, there will be no real solution to the health care crisis without a complementary solution to the long-term care crisis. They're also working together now to take next steps on a range of related issues. It's been a privilege for me to work with them on the Alzheimer's Disease Study Group of the United States Congress, and Senator Collins has been instrumental in making that effort happen as well. And today, we're working together to make sure effective long-term care reform really happens. This conference is the next step in that process. And so now, I'd like to turn the podium over to Senator Kerrey for some opening remarks. Thank you very much.
Thank you, Mark. Well, first of all, this is the first time I've been in Washington, D.C. without a tie on, and I can tell you it feels great. So, Newt ordered an ice cream cone from me already, and had he not shown up, I'm glad that he's here, but had he not shown up, I was going to announce, and I was looking forward to it, that after 4 or 5 minutes of my introductory remarks, I was going to become Newt Gingrich. But that will not happen this morning. It's also been a pleasure for me to work with Dr. McClellan, both when he was at CMS and now at Brookings. And I think I'm on safe ground saying that Mark is a very rare individual, and that he has continued his strong efforts on behalf of both health care and long-term care reform since he's left the work of the government. And I very much appreciate your service, Mark, and your enthusiasm, your intellect, and your capacity to bring people together. I very much admire as well your courage in taking on these issues, because it is not possible when so much is at stake personally, and that is something that all of us have spent time on, either health care or long-term care, understand that there's a lot at stake personally. This is not about shopping for a car. This is not about looking for a suit of clothes. This is something that's very health care and long-term care get personal in a hurry for ourselves or for those that we love. Of the things that I have learned working with Speaker Gingrich on this commission that might be helpful to all of you and set up the panels themselves is that I do think that there's the potential for Republicans and Democrats to come together on this issue and accomplish some reform that will improve the lives of people who are in the workforce, trying to make long-term care work. Individuals in the government and the not-for-profit and the for-profit sector that are trying to set the bar actually higher than either law or regulation require, trying to provide care in long-term care facilities. I believe that there are solutions on the finance side where we're going to hear panelists talk about some very specific ideas. There's a compelling problem here. Study after study after study have shown the gap between the public's capacity and the individual capacity to fund. The knowledge, the understanding of the system is short of where it needs to be. Likewise, in the area of technology, the four problem areas convert very quickly, in my mind, to opportunity for Republicans and Democrats to come together. And from my experience, limited though it may be and long though it may be in the past, it is very important to get some confidence-building measures for Republicans and Democrats to be able to tackle contentious issues. And I think that such an opportunity exists in long-term care. When I was asked to chair the commission to examine the quality of long-term care, my first response was we had to find a Republican who would be willing to co-chair it. We were very fortunate that Speaker Gingrich was willing to do this. He's been a phenomenal partner to work with. It's been a delight to be in the presence of Newt Gingrich when he challenges, as he always does, our own individual conventional thinking. We were fortunate as well to be able to recruit two sitting governors, Phil Bredesen of Tennessee and Governor Haley Barbour of Mississippi. We have four seated members in the United States Congress and the Finance Committee and Ways and Means Committee on this commission. This is a problem that's going to require both state and federal stakeholders to come together. And I'm optimistic as a result of the work that we've done that if Congress tackles this first, they'll find success in the 2009 session, and from that success, we'll be able to move on to health care reform as well. Now that I've been given the 1-minute warning, and because Newt's here, I cannot become Newt. I will do the second best thing, which is to introduce my partner, not only in this effort, but now in the Alzheimer's Study Group. It's been a pleasure to work with him. It's been an even greater pleasure for me to disabuse my Democratic friends of their prejudice against the former Speaker. I find him to be one of the most thoughtful political leaders in America today and an enormously important contributor to trying to figure out how to solve America's problems. So it's an honor and a privilege for me to be able to introduce Speaker Newt Gingrich.
Well, as you can imagine from that brief introduction to Senator Kerrey's personality, I was in Omaha last night.
I wasn't.
And I was trying to contemplate in coming here this morning how one goes from Omaha to the new school. And I have to confess I have totally failed to figure out how you manage the transition. But let me just say a couple of fairly quick things. First of all, it's great to be with Mark, who has done an extraordinary job and who is one of the smartest people in health policy in America. And we're very grateful for all the different things he's done helping us on this. It's great to be back with a number of our members of the Commission, including Monsignor Fahey, who was consistent in reminding us that there were human beings involved and that it was a moral cause. And given the Monsignor title, it probably was appropriate for him to keep re-emphasizing that, although he also emphasized the practicality of the frail elderly and the practicality of his own mother, which is something I could relate to because my mother had spent the last years of her life in a long-term care facility, a wonderful place in Harrisburg, Pennsylvania, which had people who were truly caring and spent a great deal of time trying to make her life better. It's also great to be here with Buck Stinson, who brought a great deal of practical common sense, long-term private sector thinking to what we were doing. And it's also terrific to have Mary Jane Coran here. If you look at the list of who was on the commission, Bob Kerrey assembled a really first-rate group of people, and we owe a great deal both to Larry Minix and his organization, and also to the folks at the American Healthcare Association, who really had the patience to put up a good bit of resources with zero editorial strings, and just said, we want you to go out, think about this, do the right thing, come up with the right ideas. Now, we ran into some fundamental roadblocks, and I think all of you will find out today what some of those are. But let me give you my overview that's very simple. And it starts with Lincoln's 1862 December message to Congress when he said, as our situation is new, we must think anew. And we must act anew. And if we do, we shall save the country. No people in history have lived as long as humans are going to live in the next 2 generations. No people in history have been anywhere near as wealthy as human beings are going to be in the next 2 generations. We are tasked by those 2 facts, the reality that there's going to be 4 to 7 times as much new science, generating new solutions, better health, new energy solutions, new economic opportunities, and creating tremendous new capabilities. All of these things are true. Our challenge is that we as Americans have to develop a future that is sustainable and desirable, and then manage a transition to that future with obsolescent structures, fragmented politics, and an extraordinarily complex system whose primary goal is to avoid dictatorship, not to achieve efficiency. And this is a very great challenge for us. So I just want to make a couple of brief points. At the Center for Health Transformation, we were very fortunate in that, building on our relationship with Bob, I turned the tide on him. He had asked me to chair a commission. I promptly called back and said, all right, I think the natural next step for us is to deal with the Alzheimer's Study Group. He is co-chairing that with me. A number of people here today who come from that background who've made a big difference. And I just want to make a point to all of you. Take that one example. Alzheimer's is both an enormous human pain for the family, for the individual, and it's an enormous financial challenge. For the baby boom generation presently, Alzheimer's will be $1.2 trillion cost to the federal government, plus a comparable cost to the private sector, to individuals. There is no strategic thinking in this city prepared to say, what do you do with a 20 to 30-year problem with $1.2 trillion on the table? And we are mired down in the dumbest, narrowest possible procedural rules. So one of the keys I want to put on the table today is budget reform. Because if I could spend $8 billion in the next 5 years and save $1.2 trillion in the next decade, I couldn't score the savings. There's no position for investing in the federal budget. There's no position for cost avoidance. And so you get trapped in truly dumb things. I want to close with 2 examples of how bad I think this is. But I do want to emphasize before that, as you listen to people talk today, it's important to think about first principles. If you do not have some requirement for everyone to save for the future, you are not going to prepare the next generation for reality. If you don't figure out some transition financing mechanisms, you are not going to enable the poorer half of the baby boomers to survive with any sense of dignity. If you do not fundamentally rethink how we capitalize, train, and professionalize long-term care facilities and the long-term care professions, we are not going to be able to provide the quality of life people want. And these are fundamental changes. And so I just want to close with 2 thoughts. One, real change requires real change. So every time you see somebody bring up something trivial and that with the great press conference, you know, it's baloney. It's not worth the effort to work on. You have to think about fundamental reform of this system. In fact, I think you have to think about replacement rather than repair. 2, you have to recognize that first principles are real. Why do we have a current subprime problem? Because we tried giving away houses to people who couldn't pay for them at prices that weren't sustainable, and the minute it broke down, it collapsed. Why do we have an energy problem? Because we were trying to buy more than we're producing, and you inevitably drive up price. Why do we have a system today which encourages consumption, minimizes savings, and teaches irresponsibility? And then you want to turn around and say, yes, but you should really do the following things even though nothing in the current tax code favors it and nothing in the current system rewards it. These are fundamental changes. And I'll close the thing that actually first came, was given to me by the head of ACA when we first started working on this a number of years ago. And he had a book on health reform which started with the story of a village which was on the edge of a cliff. And people kept falling off the cliff. And so the villagers developed the finest ambulance service in the world. And they had 24 hours a day, 7 days a week, an ambulance at the bottom of the cliff, and they could get people to the emergency room faster than anybody in the world. And an outsider came along one day and said, have you contemplated a fence? And they said, we don't do fences. We do ambulances. Well, I want to add a stage to that. In the current political environment at the federal capitol and at state capitals, if you walked in there, they would be in the middle of a fight over the budget in which they'd be trying to decide whether to reduce ambulance service by 1 day a week or 2 days a week, or to not pay the ambulance drivers for 2 months a year. And if you walked in and said, well, gosh, why don't we build a fence? They would say, we don't have any money for that. Don't you understand? The ambulance service is so expensive, we can't afford to think about fences. Be realistic. So that's the current political structure. My hope is, with Mark's leadership, with occasional convincing from people like Bob and me, that we will actually help Senator Collins move the Senate. And I want to close this thought because she was part of this, and she can tell you how emotional it was. When we testified recently, we had the great fortune with the Alzheimer's Study Group of having Justice Sandra Day O'Connor testify. She and I testified in Alzheimer's. We had 11 senators at the hearing for the entire 2 hours, which is fairly rare in this building. 7 of the 11 had personal family ties to Alzheimer's. I mean, their testimony was as emotional and as powerful as Justice O'Connor. And I thought it was a remarkable moment. I believe this institution is teachable. I think that there's an opportunity for people to develop solutions, and I think there are an amazing number of House and Senate members who would love to have solutions. And I think one of the people I find the most useful to work with over here, who does a great job and who really is being very passionate and very committed on trying to find the kind of solutions that will help elderly Americans and ultimately help all Americans, is Senator Collins. And it's a real honor to be able to introduce her and ask you to welcome Senator Collins of Maine.
Thank you very much, Newt, for that very nice introduction. Thank you, Bob Kerrey, for inviting me to participate in this event. I can't think of 2 more creative minds than Bob Kerrey and Newt Gingrich. I just love hearing both of them talk. When Newt was quoting Abraham Lincoln and saying that we need to think anew, I couldn't think of 2 individuals who have done more to help us think anew than Newt Gingrich and Bob Kerrey. And part of that second inaugural address that Abraham Lincoln gave went on to say that the dogmas of the past are inadequate to the stormy present. I mentioned that to show Newt that I, too, know the speech. And to try to impress him, but also because I think that it summarizes what we're trying to do today. We're trying to break the way we've always thought about long-term term care and instead come up with new approaches. It's also good to be here with Mark McClellan. I'm not so sure that he's really happy to see me, however, because the last time we interacted was at a hearing before the Special Committee on Aging, and I harangued him about a CMS policy that was adversely affecting graduate medical education in my state. And he had to listen to me talk about the impact on rural health care, on our ability to get family doctors trained and serving throughout Maine. Do you remember it, Mark?
I do.
I had a feeling that you might, but it's great to be here with you as well. I am, along with Senator Clinton, the co-chair of the Senate's Alzheimer's Task Force. And I am particularly sensitive to the long-term needs of patients with chronic diseases like Alzheimer's. As Newt mentioned, this is a true crisis that is going to happen if we don't come up with a better approach to long-term care. We have some 5 million Americans who are suffering from Alzheimer's today, but of course that really understates the number who are suffering because, believe me, their families are victims as well. And that number is going to explode because of the demographics of the baby boom generation. So this morning's discussion is going to focus not just on the financial challenges of providing affordable long-term care to an aging population, but also on the opportunities that we have to improve the quality of that care. Long-term care is the major catastrophic health care expense faced by older Americans today, and these costs are only going to increase as our nation ages. Today, more than 37 million Americans are over age 65, and these numbers are going to rise dramatically when the baby boom turns into a senior boom. Over the next 20 years, the number of Americans over age 65 is expected to more than double. In my state, which is one of the oldest states in the nation, more than a quarter of the population will be over age 65 in the year 2030. And nowhere does the aging of America present more risk and more opportunity than in the area of health care. It is not just that there will soon be more older Americans, it's also that older Americans are living longer. The oldest old, that segment of our population, age 85 and older, is the fastest growing segment of the American population. And obviously that's also the very population that's most at risk of the multiple and interacting health problems that can lead to disability and the need for long-term care. So we know we're facing this tidal wave, an unprecedented demand for long-term care services. But I will tell you that when I talk to my constituents, I find that many of them have made no preparation whatsoever for long-term care. A substantial number of them believe that Medicare will pay for long-term nursing care. Think about that. And that's one reason they're so unprepared. A bill that I authored early in my Senate term provided long-term care insurance for federal employees at a group rate. It's not subsidized by the federal government, but the federal government uses its buying power to come up with a group plan that is more affordable. But think about that. Until just 5 or 6 years ago, the federal government didn't even offer long-term care insurance as a benefit. Unless we take action soon, our nation will be totally unprepared to meet this challenge. There's currently a great deal of discussion and debate about ways to reform our ailing healthcare system. Our long-term care system deserves equal treatment, yet it's often not part of the debate. The debate tends to be focused on how do you expand the number of Americans who have access to health insurance, or it focuses on the burden of health insurance on low-income Americans or those who are self-employed or small businesses. But there really isn't that much discussion of long-term care, and that's why this forum is so important. We're fortunate today that there are so many distinguished and expert panelists that are going to be joining this forum to discuss the next steps our nation should be taking toward the goal of a new and improved long-term care system. And it has to be one that will provide quality long-term care services in a variety of settings. Too often when we talk about long-term care, everyone just thinks about nursing home. They're obviously critical, absolutely essential. But the fact is that many people would rather stay in the comfort, privacy, and security of their own home as long as they possibly can. And that's why we've also got to look at alternative settings. We've got to look at home health care. We've got to look at hospice care. We need to broaden the discussion of long-term care. And we also have to consider approaches that will allow seniors and individuals with disabilities to remain independent as long as possible. Again, I'm pleased to be here to help kick off the discussion, and given the expertise of the panelists who are here today, I am confident that this is going to be a truly exciting debate. Thank you, Mark.